All right, Jordan. Thank you so
All
much. Go ahead
right.
and take the mic.
Awesome. Yep, I'm going to share my screen and start from the beginning here. So, hi, my name is Jordan Searles. I'm a prenatal, postpartum, personalized personal trainer. So, I got my certification through originally NASM, which is kind of the broad general personal certification for trainers for the general public. And then through my own postpartum and prenatal struggles, exercising and realizing that there's such a large gap in the system and support for moms, I realized that there needs to be more done for them. So I went and got certified specifically for pregnancy and postpartum training. So those two certifications are Girls Gone Strong and then also Pronatal. Those are two very well known and well versed in the perinatal space. So I've learned so much through these certifications and also, again, just educating myself on just how really unique pregnancy and postpartum exercise really is, and that just going to general trainers and general camps and general classes and everything, it really doesn't address the very, very, very specific and unique needs that every single mom needs. So as far as this workshop goes, I have lots of questions to ask you, and feel free to engage as much as you like, as little as you like. If you're just here to listen, that's fine. Feel free to drop things in the chat. You can ask questions. I'm going to try to kind of look at both here and there, but again, we'll have like a big Q&A session at the end. So if I miss a question, we can make sure we can go back and address it at the end. But yeah, you can drop your answers in the chat and we can kind of keep things rolling one thing at a time here. So as far as the what we're going to talk about today, so let me make sure I can. Hold on, I have to move my one video over to the side here. Okay, there we go. So we're going to talk about pregnancy and postpartum exercise, the guidelines, and just kind of general safety concerns and measures. Then we're going to talk about benefits for both pregnancy and postpartum, any practical exercises and specific modifications that you need to be aware of. And then, like I said, we'll have that Q&A session back at the end. So the exercise during pregnancy, basically, and any kind of research that goes along with that. So exercise is really important, especially regular exercise during pregnancy, can actually lead to a healthier outcome for both mother and child. So, including improving your mood, increased energy, a possible and easier labor as well. So, there's a lot of benefits for both mom and baby as well. So, it also helps with baby's ability to handle stress during labor, which is I would assume a lot of moms' concerns of, they watch the baby's heart rate and they pay attention to, how baby is handling the stress. There have been studies now that a mother who works out during pregnancy, that baby is able to handle the pressure of contractions and elevation and spikes in heart rate and drop. They can handle it a lot better than babies who whose mothers did not work out during pregnancy. Also, gestational risk of gestational diabetes risk drops as well. It's a big concern these days. And then also postpartum depression drops. And then lastly, again, birth outcomes and recovery time are drastically affected by exercise during pregnancy as well. So in the chat, you can drop too, and we're going to talk about this later. But what are some things that you have heard about pregnancy and exercise, whether it's good or bad? What have you heard about it? Let me see if I can make sure I can see all these answers and responses. There we go. So what have you all heard? Okay, I was told not to lift. Yep. So good or bad? Anything that you've heard? Yeah, they always, yep, older, yep. I know my mom immediately said stop. You have to rest when you're pregnant, right? Yeah, so a lot of it is more on the cautious side, right? Okay, continue is tolerated if you were active prior. Keep doing exercises that your body was used to before pregnancy. Okay. Yeah. So a little bit of like both, right? So, actual exercise guidelines for pregnancy. So, ACOG recommends at least 150 minutes of moderate intensity exercise that's weekly. So, recommended activities include walking, swimming, prenatal yoga, and in fact, strength training, right? So, one of the myths to talk about, like not lifting, but regular exercise can significantly enhance physical and mental well being, right? So, healthier lifestyle, healthier lifestyle, positive birth outcomes, but of course, always, you want to talk to your healthcare provider just before beginning any like new exercise programs, really, just in case there's any other underlying health conditions, any kind of like risk for preeclampsia. Placenta previa is another one to keep an eye on that could affect exercise during pregnancy. And again, any risk for gestational diabetes, high blood pressure, just all of those things that your doctor would know that you have either a family history of. That is where you definitely want to talk to your doctor first before beginning anything. But if you're medically, in general, healthy, you take care of yourself, you don't have any really large underlying health issues, exercise is 100% recommended for pregnant women. Um, if you were strength training before your baby, you can continue to do so. Also, however, that doesn't mean if you didn't strength train, that doesn't mean you can't. It just means that you should probably start a little lighter and not doing as complex movements or really intense movements for strength training, basically. Um, Personally, the biggest things that I like to talk about too is what you see on social media, right? Is all about like, oh, like be safe, right? Like this is safe for pregnancy. This isn't safe for pregnancy. And it's a lot of fear behind it, right? Like safe, right? So what I like to spin it is say like, here's what is appropriate for pregnancy because it's also everyone's pregnancy is uniquely different. But there are two things that I say absolutely you should avoid during pregnancy, at least. So, contact sports slash exercises with a fall risk, right? Like horseback riding. You probably shouldn't. There's that risk of falling. You never know what happens, right? Contact sports, right? Same thing. Risk of injury, just not great. And then also hot yoga or working out in the extreme heat. Like if you go for a garage workout, like I do, I have garage 100 degrees in there. It's not air conditioned. I have stopped my workouts. Oh, I also forgot to say, I'm 4 months pregnant with my second kid. Um, so that's another little tidbit about myself. But avoiding working out in the extreme heat. So making sure that you are hydrated and the risk of dehydration drastically increases during pregnancy because our demand for water increases as well. Now we're trying to refuel our body and give water back for two people, basically. So working out with hot yoga and again with extreme heat, that is definitely a no-go for pregnancy. That's one that you can take a break from. But again, walking, swimming, prenatal yoga, strength training, those activities are great for pregnancy. So, the essential exercise for pregnancy and wellness, just keep moving basically. So, like I said, yoga sessions, low impact, strength training, walking, high impact activities. They also say lying on your back for extended periods of time, like long periods of time, if you're ever exerting yourself there. And then heavy weightlifting, like going for maximum effort, PR, lifetime lifting weights. That is not saying that women can't do it. It's become one of those things where there's just not enough research being done and not enough, again, women in a broad perspective of it and a broad spectrum willing to do that during pregnancy as well, right? Like moms want to look out for themselves, look out for the baby. So, to sign up for a study being like, hey, we want to see you go maximum effort and then we'll see what happens. That's going to be tough to get studies done there. So everyone errs on the side of caution with that as far as extreme heavy lifting. And we can talk about your rate of exertion and how heavy you can lift or how hard you can do some cardio and your exertion rate in a little bit. So you'll kind of see what that level looks like. So recognizing important warning signs during pregnancy and exercise. So when are the times where you should say, this is not for me? Or when is the time where, oh, I should probably dial back my workout a little bit or dial back this exercise, basically? So the biggest one for symptoms to watch during your exercise is severe abdominal pain, any unusual shortness of breath, and heavy bleeding or spotting there. So also you want to make sure that you are um, being aware of any kind of chest pain, pressure, severe headaches, vision changes, sudden swelling in your hands and feet. So all of those are definitely like talk to your doctor right away. You should stop basically when these signs are coming up and go talk to your doctor right away. So when to actually know when to modify an exercise. So modifying is just slowing it down a little bit, and just the exercise means that it's too strenuous for your body at that moment. So coning, doming of the abdomen, pressure downwards, pushing into the vagina, basically like you feel like something is falling out, like a tampon, basically. Or if you just have, you're in the middle of a movement and all of a sudden you have that sudden urge to urinate or empty your bowels, that's just a sign that that specific exercise is just too demanding for your body to handle at the moment. So, like a good example, let's just say you're doing jumping jacks, and then all of a sudden, you've been doing a couple of reps, and then on the 10th rep, you're like, whoa, I almost just peed my pants. That's your body saying that there's too much pressure going downwards. So we just need to dial it back. So maybe instead of jumping, you just step it out and move your hands overhead instead of doing the full plyometric. So that would be a small example of how to just dial it back a little bit, but you're still doing the same exercise. This picture over here is a really good visual example of what coning looks like during pregnancy. And I'm going to talk about that a little bit more in a little bit in more of like the postpartum section, but coning is just a sign that you're having more pressure come outwards towards your belly because our ab muscles begin to separate as our belly grows. And that has to happen for pregnancy to happen. It's not something that can be avoided. It is something that is 100% natural and necessary, again, to have a baby. So, watching that coning and doming is important to maintain good posture and maintain general strength throughout pregnancy, and not making a postpartum recovery a little bit more difficult, basically. And we're going to talk about that again in a couple more slides. For those of you that, again, just joined, feel free to ask any questions in the chat. And again, we'll have a Q&A down at the end too. So strength and strength training the core, pelvic floor. So a couple of things to consider while you are pregnant is that 100% every single woman by the third trimester will have diastasis. So like I talked about before, that separation of your ab muscles. By the third trimester, everyone's got it. I've been seeing a lot of stuff on social media where it's like prevent diastasis or heal your diastasis or like do all of these things for diastasis during pregnancy, and you can't avoid it. You can do things to not push out more and engage the core more and protect the stomach and not put as much pressure on it, but everyone's going to have diastasis. So the biggest thing is making sure that you can work on your core during pregnancy. I know that's another myth that comes up, is that you shouldn't do any core work while you're pregnant. That's false. That couldn't be more false because, again, your core is your core muscles. Your core supports your back, it supports your hips, supports everything. So if we just disregard that muscle group throughout our whole pregnancy, it's going to be really rough. So making sure that we learn how to engage and strengthen our core during specific exercises helps support your posture, which changes drastically during pregnancy, and then overall strength as well. So Pelvic floor awareness, also understanding that, how being able to strengthen and also relax your pelvic floor can aid in preventing discomfort, any kind of complications during or after pregnancy. And again, every single woman is different with this. So some women might have, pelvic floor dysfunction. They're, peeing your pants during exercise. You might have pain during intimacy, but there's a lot of different routes that the pelvic floor can take during pregnancy and also postpartum as well. So, what appropriate exercises are is just appropriate for your fitness level, your trimester, and your belly size. Those are the three main dictators of what exercise you should be doing during pregnancy. So, these exercises in general should all help with your core strength. And then also, they should again be appropriate for you and also your baby. Again, like I said, you should always talk to your doctors first if you have any other underlying health concerns. So let's talk about actual exercise modifications per trimester, right? So just some things to consider as you're moving through your pregnancy, right? First trimester, typically, like I said, I mean, it lumps into what we talked about before, but contact sports are out, high fall risk activities are out, and hot workouts. Those are the big couple of activities that you should be modifying or completely taking out. As far as all the other exercises, there's not a lot of modifications to go with it. For your second trimester, usually elevating our hands for planks and using caution with heavy rotational exercises. So, putting your hands up on a step, on a bench, on a couch, just any way that your hands aren't just on the floor when you're doing like a high plank, or if you're doing push ups, maybe you elevate your hands so you have elevated push ups or incline push ups. Then heavy rotational exercises, think Russian twists, right? When we're rotating side to side. Heavy meaning you have a heavy weight with you and you're twisting like that side to side. So anything with heavy rotational exercises. The last one, again, this is on preference as well and how you are feeling, how much your belly is growing. Typically, most women start to modify exercises that require you to lay on your belly. This is called the prone position. So, laying on your belly, think Superman's, right? So, where we're laying on our belly, we lift our arms and our feet at the same time. We get a back exercise. And that is an exercise that I have started modifying myself. I just don't feel good laying on my stomach anymore. So, that is something to consider as well. Could be early in the second trimester, could be later in the second trimester. There's no specific point. Again, that's you learning to listen to your body. For the third trimester, again, it's, oh, hold on, let me go backwards. There we go. For the third trimester, it's everything we talked about before, plus front loaded exercises. We're going to start to modify the weight. You're not going to go as heavy. High impact plyometrics. So, again, we kind of talked about jumping jacks before. Any kind of jumping, really heavy impact. Most people are going to try to modify that. Running, usually, again, is starting to go out for third trimester moms. Exertion in the supine, so that's laying on your back position exercise. So if you're thinking laying on the floor doing a floor press, if you're doing anything any kind of like really heavy bridges, just again laying on your back super heavy. You don't want to lay there for very long. That can put pressure down on one of the main arteries going in the middle of your body, basically, and it could impact blood circulation to you and the baby as well. So that's why they say usually on your back exercises for long periods of time, try to avoid that. And then lastly, postpartum, quick little tidbit on this, avoid overexertion. Try to avoid lifting heavy other than your baby, right? That's just not realistic when doctors tell you, you know, don't lift anything over, 15 pounds or 20 pounds. And it's like, well, my kid is, 9 or 10. Let's say they come out relatively large, 9 or 10, plus the car seat, plus the diaper bag. Like, okay, but, try to avoid doing any extra lifting outside of that, right? And then lastly, walks begin once the bleeding stops. So you can introduce some walking as that starts to as you start to heal a little bit. And again, we'll talk about postpartum in its own section. Um, let's go next. Okay. So the postpartum exercise here. So for those of you that are postpartum, if anyone is postpartum here, what were, or if you've experienced postpartum and are pregnant now, either way, if you've experienced postpartum, what has surprised you most about your body's recovery? If you don't mind sharing that. Whether it was something positive, something that you were like, I didn't think my body was going to be able to feel this way. What was something that surprised you most about your postpartum recovery and how you felt? And you guys can just type it in the chat.
I know for myself, I didn't really do a whole lot of exercising afterwards. I was nursing.
Hmm.
And I think I didn't really start doing any walking. She had to be a good, probably a month or two. I didn't do really too much of anything after that, after
Mm,
birth. It took me a little while. I mean, just from just not, yeah, I pretty much did maybe walking to the grocery, in the grocery store, but nothing major. With me breastfeeding too, I was like, I'm in the house.
hmm. Yeah. And it's a lot too,
It
like
is.
the first couple of weeks, even the months are just it's just pure survival mode, right? So you might notice immediately postpartum, right? Like your belly might feel like jello, like there's nothing there. Um, I know personally, I was really surprised at how my first walk out, like a walk for exercise, meaning I went out for 5 minutes, but I was really surprised at how weird my hips felt when I was moving. Like I felt like my hip sockets, like my hip bones were like coming apart and like my femurs were just like not connected to my hips. Like it was really awkward and loose and not just did not feel like me at all. So that was one of the things that was like a major change and a shift, right? So returning to actual exercise, right? Clearance, again, I use that in air quotes because again, doctors, that's the rough timeline, but I'll talk about why through my experience and through my trainings that this is inaccurate. But you get your clearance from your doctor officially at roughly 6 to 8 weeks for your appointment, 6 weeks typically for a vaginal delivery, and 8 weeks for a cesarean. Lastly, you can introduce some gentle stretching, some mobility, some walking before that official clearance. Again, as long as the bleeding has stopped, and again, you are listening to your body, you're not trying to overdo it too much too soon.
Another reason why I couldn't really do a whole lot of activities, I had bruised my tailbone during
Mm,
delivery, and I was in pain for a long time.
that's tough.
It took a long time to heal. There's nothing you can do about it. You have to wait. It has to heal on its own. So very
Mhm.
painful.
Yeah. Yikes, that's really tough. And how do you rest too, like you can only basically like lay down. So as far as postpartum actual statistics, like I said, diastasis at 6 weeks, about 60% of women still have it. At 6 months, about 40% still have it. And then pelvic floor dysfunction. So some kind of pelvic floor, meaning either incontinence, pain during intercourse, you have just general pains and aches as you move. If you feel any kind of pressure downwards, that could be a sign of prolapse, pelvic organ prolapse. Um, so there 80% of women experience that, regardless of whether you have a C-section or a vaginal delivery. There is again another myth that's out there that if you have a C-section that you're not going to have pelvic floor dysfunction, and that couldn't be that couldn't be less true. So the way the C-section works is, it severs through several layers of tissue, which disconnects the nerves. So your nerves don't talk to each other. So that affects how you empty your bladder. It affects how you manage your pressure postpartum. So now there's more pressure going downwards. And again, with incontinence and reconnecting to the pelvic floor, there could be a lot of issues for pelvic floor dysfunctions for moms that experience cesarean births. Now, that actual appointment. So, things that they actually check for. So, they check for your uterine involution, making sure your uterus is going back down to its size. They check to make sure your scars and your stitches are healing. They do a basic pelvic exam just to make sure things are okay. They double check for cervical closure. They do your normal, like, wellness visit, your blood pressure, your weight, and they do the mental health screening. So, what they don't check for. This is the biggest thing, and this is what really gets under my skin as a personal trainer and someone in the fitness field is doctors are clearing people for exercise when they don't actually move the patient through exercise to assess them. If anyone here has been to physical therapy before, they check your range of motion of your injury. Let's say, you had an ankle injury or you rolled your ankle or sprained your ankle. They move you through it to assess where you're at and your fit and where your healing is. And then they take the program from there. Doctors just do those basic checks and then just say, yeah, go ahead, you're cleared for exercise and just take it easy. While I'm talking about that too, if you guys want to drop in the chat too, if you were postpartum, what did your doctor tell you at your 6 or 8 week appointment? What did they say for your exercise? And then I just see a question from Jay. Will they check these items if we ask them to do so, or is that something for postnatal? So the things that they don't check for is outside of their, I wouldn't say practice, but it's outside of like what they know basically. So they wouldn't really know how to assess truly your pelvic floor strength, your coordination, or pressure management. That is something that specifically a pelvic floor physical therapist will know how to assess. So this is one of the biggest things is that at your 6 week or 8 week appointment, fight for that script for physical therapy. Do not walk away without one, or at least getting your doctor to refer you out or list some options that you can go to, but don't don't accept their answer as, okay, well, this is just how I feel now, or like, yeah, my doctor cleared me, I'm good to go. But these couple of things are really, really important for, again, returning to exercise. So it's scary, but most doctors actually don't check for diastasis. They don't check to see how your abs are healing. And that is a huge, huge, huge part of going back to exercise. So also talking about, your individual recovery factors is everyone is so uniquely different. So how is your sleep? How's your nutrition right now? How was your fitness before pregnancy? All of those things affect your postpartum recovery and where you're at. And then lastly, do they check your posture? Do they check your movement patterns? How are you bending over and picking up your baby out of the crib? How are you holding your baby on a daily basis? How are you holding the car seat carrier? They don't see that. They don't look at that. They don't check for that. So that's where a pelvic floor physical therapist really comes in because they know how that all works and how it coordinates with one another. So that was a good question, Jay. So warning signs postpartum, understanding when to actually, again, reach out to your doctor when things feel like it's too much. So the biggest ones are if there's an increase in bleeding. So if you stop bleeding and let's say you go for a walk a day later, or maybe even that afternoon, you start bleeding again, that could be a sign that you went too much or you did too much. So I would definitely reach out to your doctor again. Any kind of extra swelling or soreness in the perineum. So anything that's just more than normal, increased leaking, any kind of heaviness, again, pain or feeling like something is falling out, any chest pain, any extra lightheadedness or dizziness. All red flags, immediately call your doctor. Things that, again, are telling you to slow down. Any movements that cause that bulging or doming in the stomach. So, yes, recovering from diastasis postpartum. You want to keep an eye out for coning and doming. If you do have like an occasional leak, so let's say, you try to do a sit up or you try to do maybe a core exercise or just something and like you accidentally leak a little bit, that would be a sign like, okay, that exercise is too tough. Let me dial it back and then try it again and see and make your adjustments there. Shirley said, at my 6 week appointment, I was told I can resume my normal workout routine. That information did more damage to my pelvic floor and DR. Yeah, that's usually the go-to if they don't see any large warning signs that they basically just clear you and say, okay, just like take it easy. It's really misleading and unfortunate and causes a lot of problems for women. And then lastly, any activity that leaves you feeling worse when you're done. So, let's say you go out for a 20-minute walk. Maybe your body's not quite ready for that 20-minute walk. That afternoon you feel like, "Oh, I feel really achy, my back hurts, I feel a lot of pressure like pushing downwards." That is a sign that you went too much too soon. So the biggest thing is recovery during the fourth trimester is crucial for mother's well-being, right? So fourth trimester, I feel like is something that not a lot of women talk enough about, is that, that time period, roughly like 0 to 3 months or so, that's really, really crucial for your foundation to return to exercise. It teaches you really like who you are as a mom, right? Like you're learning, if you're a first time mom, you're learning how to be a mom. You're learning your baby, you're learning how to talk to your partner again with a child. You're learning all of these things. So taking the time to actually heal and not rush back into exercise is so, so, so important to set you up for a more successful postpartum period. So, postpartum considerations here. So, the biggest things we want to focus on are exercise modifications. Again, like I said, breathing, mobility, gentle walks in the very beginning, core rehab, right? Fight for that physical therapy prescription, referral. Just try as best as you can to get into pelvic floor physical therapy. Focusing on your nutrition. And I know this sounds like a joke, and I even laughed at it with all of my birth classes too, is like sleep. It's just get what you can, right? Try not to fall into the trap of, well, I should be doing laundry or I should be doing the dishes or, I should do this. Like, try not to fall into that trap. Try not to put put activities on yourself that other people 100% can do for you, and don't feel like you're being selfish for it. Go sleep. That's the only real way your body actually recovers is sleep. When we have that shutdown, that REM, that's when our muscles and everything rebuild themselves, get stronger, and our energy levels as well. So sleep, sleep, sleep. And then lastly, right, like your emotional well-being. So make sure that, you are trying to find as much support as you can if you're feeling, any kind of extreme sadness, anything like that. Like, do the screenings honestly with yourself when the doctor checks in with you. Talk to your partner as best as you can. And then any kind of mental health, mindfulness that you can incorporate daily really will go a long way. And then let's talk about the 3 to 12 month time span, basically. So, this is where you can start to gradually reintroduce strength training and other exercises. This could be where a slow, progressive return to run program might be introduced. So, not just winging it and going out for your first postpartum run at 5 months. Not the best way to go back to it. There are certain precautions and certain routines that you can do to ease back into it to make sure your body is actually ready to go back. Rehab, pelvic floor PT, like I said, but biggest common issues with moms: weak glutes, you have tight hip flexors, you have that forward bent over posture, especially if you're breastfeeding, right? Holding baby, shoulders come forward. And then the biggest one, back pain, right? Last, for nutrition and sleep needs as well. Again, talking about breastfeeding moms specifically, you typically need about an extra 300 to 500 additional calories, and then also drinking at least 120 ounces of water daily, which is a lot. But breastfeeding, making milk requires a lot of fluids. And then again, your emotional well-being. A lot of people in society unfortunately think that, by 5, 6 months, like you're an experienced mom now, you know how to handle it. And I'm not 100% sure about your experience, but for me, like, I definitely had some kind of PPD in that like 5 to 6 month time span where everyone just kind of like left. And I just felt really isolated that I was still struggling figuring things out by myself. So find your village and keep them, right? Ask them for help. Still don't feel like you're a burden on them because you are asking for help. So family, friends, a therapist, just any kind of resources that you have, get that help that you need. All right. So we're going to do a little exercise just to kind of move it, shake it up a little bit. Let me see. Drinking water. Is liquid IV okay to drink or Pedialyte? So liquid IV, liquid IV, I do know has a little bit of a higher sugar content, so I would be aware of that one. A resource that I really like right now that I'm drinking during pregnancy is from Needed. If you want, I can send you a link to it later, or I can try to drop one in the chat at the end. But Needed has really good electrolytes, and it has a lime, lemon, and a grapefruit flavor, and it's not like super overpowering. It's just a nice little like dash of flavor into water, and I'll drink that in the morning too, which is really nice. So definitely like, adding something else like that. I would again just like check out what the added sugar content is. Yeah. Yeah, I'll make sure I drop that in the end, and I'll write a note on that too. Okay. All right. So some exercises, okay? So you don't have to turn on your screens if, you have some space to move around and just get out of your seat a little bit, right? We don't want to be stuck sitting like this for a little while. So these are all appropriate for both pregnancy and postpartum, and these might even feel really good, especially in later pregnancy and also, again, that early postpartum. So the biggest thing is talking about reconnecting to your breath. So that's 360 breathing. A lot of women, especially later pregnancy, we tend to breathe with our chest because everything gets pushed up, right? Baby shoves all of our organs up. There's not as much space for our lungs to expand. Our diaphragm can't push down anymore. So we end up breathing like this with our shoulders and with our neck. When we're postpartum, our body still thinks that there's a baby in our belly. So the way we breathe, like that, still continues. So really reteaching our body how to breathe with our ribs, with our belly, with our back, with our pelvic floor, with our diaphragm, 360. So all around, reteaching that is really important. During pregnancy, 360 breathing can help with birth. It can help with, again, creating space for baby and also opening up your back a little bit more that used to be really, really tight. So 360 breathing, what it is basically, if you can, find a neutral position in your seat. So make sure your shoulders are over your hips and you kind of have a nice firm surface down on the floor here. Now, you're going to take your hands, put them right by your rib cage, and as you take an inhale in, you're going to think about one, your pelvic floor just relaxing. Okay, we're not trying to be nice and tense here. We're just breathing downwards a little bit and letting our pelvic floor relax. So as I breathe in, I'm thinking about pushing my rib cage into my hands for a little bit of feedback. Expanding, not breathing up, letting my shoulders relax, and then as I breathe out, just letting everything naturally come in. I'm not trying to force the breath out. I'm just, again, just trying to create space, 360. Little hold at the end to really check in with your pelvic floor to make sure it's relaxing. And then as we breathe out, everything else is coming back to where it originally started. So that, again, helps us prepare for birth. And then also, again, reteaches us how to breathe postpartum. The next one, the core canister hold. So this is learning how to actually engage your core while also potentially doing another movement, right? So we engage our core when we're doing a deadlift, or we engage our core when we're doing a squat. Learning how to hold that position while also moving your body is really important. So for a core canister hold, you want to think bottom up. So we're going to start with our pelvic floor. As out, we breathe out and we're going to think drawing our pelvic floor up. So a lot of different cues out here for it. So there's one I've heard: you're picking up a blueberry with your vagina. You're thinking like your vagina is like a tissue and you're picking up the tissue from the middle, right? And it's like drawing everything up. The other one is it's like an elevator. So we're starting bottom up. Okay. So whatever you think, like either just like, and it's not just, the other tidbit here is it's not just a Kegel, which is stopping urination basically. That only works the real front half of your pelvic floor. We're thinking whole pelvic floor, so front, sides, and back. So bottom up pelvic floor, and then our lower abs start to engage. We engage the sides of our obliques, and then our upper abs are the last ones to start to engage. So we start with that 360 breath. And again, I like to put my hands on my rib cage. Breathe out, and then on the exhale, I'm going to start bottom up. So I'm going to think pelvic floor, lower abs, obliques, and then my upper abs are the last to engage. So that is how to make sure our pressure management is working from bottom up is really good for pregnancy again and postpartum when you begin to start lifting again. The reason why we want to do bottom up is because that helps manage the pressure. If we started top down, the pressure is going to go down to the weakest point, which during pregnancy and postpartum is typically going to be either our pelvic floor or outwards where our diastasis is. And then lastly, one of my favorite exercises, your classic cat cow, right? For that low back, any kind of hip pains, and just expansion in the back is really important. Great for SI joint pain, and again, mobility for pregnancy and postpartum. The other thing that I really like to add in is a yoga block. So if you put your yoga block on one knee and you shift your weight over onto that knee, you're really going to feel that side start to stretch and lengthen and gain space. And you go through the movement and then you switch and go to the other side as well. Again, postpartum and pregnancy is great. If you don't have a yoga block, a pillow will work. It's not as, elevated or supported. If you have, I was just looking at this on my desk too. You have a stack of copier paper, right? Or a thick book, anything that'll elevate your knee a little bit more so that your hips are offset. All right. So, some myths. Okay, we talked about a couple of them before in the chat too. So, the biggest one that I have really come across in my personal experience was that you can't raise your heart rate above 140 beats per minute when you're pregnant. This is just simply outdated because women's heart rates generally increase in pregnancy. Like your resting heart rate is not the same when you're pregnant than when you are not pregnant. So already your heart rate is already going to be high. So using this is inaccurate. Also, certified prenatal specialists, we use an RPE scale. So that's a rate of perceived exertion. So how hard do you think this exercise is? Can you talk through it? Can you get a couple words out? Or is this maximum effort? I can only focus on this one thing. So we try to find that sweet spot. It's typically on a scale of 1 to 10. So we typically want to not train past an 8. So that's typically the guidelines that we use. And again, it's perfect because it's adjustable for every individual. Every individual's rate is going to be different from the next. Myth number 2, lifting weights will harm the baby. We talked about that as well. Again, both benefits mom and baby for lifting weights. And then lastly, I know the biggest one, everyone says eat for 2, right? Oh, you're eating for 2, have more, have more. Quality matters more than quantity. So really, during pregnancy, you're only really needing to add an extra snack, roughly between 300 and 500 calories. It's not an entire meal. So if you feel like you need to eat more, chances are you really don't. Like a good protein bar, a good granola bar, maybe a couple extra veggies on your plate. some healthier fats, just something else that you can add in a little bit, maybe like a mid-morning snack, some yogurt, just something else that's not huge will also is perfect enough. You don't need to be eating for two. So as we kind of wrap up here, right, you really want to make sure that you're building your own support system. So as far as exercise and workouts, it gets really tough, especially postpartum. So workout partners or have mom groups. There's tons on Facebook that are available too. Maybe virtual classes might be the thing for you in the beginning because who has a schedule with a newborn? It doesn't exist, right? Those 0 to 3 months, there is no schedule, there is no routine. Like, and just when you think you have one, it's out the window, right? You get some kind of regression. There's teething. There's who knows what. Baby gets sick, you get sick. There is no schedule. So that virtual class option where, ooh, I have 25 minutes, let me log on and do something now. That can really allow you to build a little momentum without feeling guilty of saying, oh, it's 8 o'clock and I missed my class already. Communicate your needs early and clearly with your partners and family. Tell your partners that it's my priority that I need to work out for myself. I'm going to take this 20 minutes right now. You take the baby. I need to work. I need to do this for me. I need to be uninterrupted. And then again, like I said, mental health therapist, a physical therapist, lactation consultant, perinatal personal trainer, postpartum doula, midwife, all of these resources are here to help you utilize them as best as you can. And then actual realistic goals for fitness, right? A lot of us are going to have these really, most of us might even have these, drastic expectations of seeing like the before and after, right? So being realistic with yourself and setting actual achievable goals, right? So the biggest thing is consistency over intensity. So if you get 10-minute workouts in, if you get 5 of them throughout the week, that's 50 minutes of exercise. That's fantastic. So, and even if you get three, right, that's still 30 minutes. It's better than being like, well, I can't do anything now. So consistency over intensity. Celebrate your small wins and your small progresses, right? Even just saying like, I got a shower today. That's a huge win. And then sometimes rest is the goal, right? You can't make any progress if your body's just chopping away, chopping away, chopping away, and just running on empty all of the time. Sometimes the goal is to rest. And then again, stop comparing yourselves, even between pregnancies, right? Every pregnancy is completely unique from person to person. How a person recovers, drastically different. Your journey is yours. And then some resources that I've come across that have been pretty helpful for moms and some online programs. These aren't personalized, they're for general, again, pregnancy and postpartum healing. Mama Stay Fit is really good. They have a really good Instagram account too. Get Mom Strong, she's great. Again, online programs, but not specifically personalized. And then Dr. Margot Kay, she really works on pelvic floor stuff and she offers some programs for like incontinence, prolapse. So she's a really good resource for that area if you feel like you're struggling. But any pelvic physical floor physical therapists that are in your area, start checking them out. And then a certified prenatal postpartum personal trainer like myself, right? I add in that personal touch to it that's really given based on your feedback as, a client and someone training. So, biggest key takeaways here, right? Exercise is safe and beneficial for most pregnant women and postpartum women. Start slowly, listen to your body, get the extra help you need when you're postpartum. Focus on your long-term health rather than the quick fixes, and just be careful who you follow and what you buy on social media, just because there's a lot of fear mongering out there. There's a lot of women taking advantage of postpartum women when they say, "Oh, like lose the mom pooch in 2 weeks." Well, that's a red flag there. Bounce back, right? Bounce back culture. It's really not good on a postpartum brain, right? So please, please, please don't fall for that. Really evaluate who you are following on social media. And then just to kind of wrap it all up, here's me for support, right? So my email, fitness.musclemama. I think when I converted this, it kind of shifted everything a little bit, but it's fitness.musclemama@gmail.com. My social media is musclemama_fitness on Instagram. And again, I'm a certified prenatal postpartum personal trainer here. And now, the biggest thing, questions for you. Anything left unanswered, any concerns, anything else regarding specifically prenatal and postpartum fitness? Like we can dive into some of those myths that you heard, or maybe, some exercises or activities that you feel like, should I be doing this? Why don't you guys drop them in the chat here?
With your contact information in there. And this information
Yes.
will also be sent to you when I send the recap out as well. So I'm gonna put your Instagram in here too. So hold on.
Okay. Yeah, and then I just put up on the screen too. I got my QR code for my social media, which will bring you right to my Instagram profile. I also put in as well the when I can workouts. These are very simple, various workouts that you can do. I would say they'd probably take maybe 15 minutes or so. Short, sweet, to the point. They're also pregnancy friendly. So you can scan that and you can have access to that as well. And then lastly, a big question that I get a lot again is the prenatal exercise timeline. So what modifications you should be doing, what should you be aware of. If you scan that, you'll have that little timeline there as a reference to navigate through your exercise as you go through your pregnancy as well. So the biggest thing too, on social media, I'll be filming a couple of the demos of the when I can workouts. So if there's an exercise on there that you're not 100% sure of what it actually looks like, I will be demoing it on my Instagram. So make sure you give me a follow there as well. And you can actually see those workouts kind of come to life a little bit as well.
Excellent. Yeah, I'll be looking out for them. I can share that on our page as well. So
Awesome.
yeah, sounds
Okay.
sounds good.